Hello, I'm Joanna Cohn, Director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. I'm very happy to have you here for our Innovations in Tobacco Control lecture series. And today I'm particularly pleased to introduce our speaker, Les Hagen. Les is the Executive Director of Action on Smoking and Health, or ASH Canada. And he's had that role for over 3 decades. He has been dedicated to tobacco control long before many of us, long before me, and before we had an FCTC, before we had many of the interventions that that are sort of the backbone of Empower these days. Les is also an adjunct professor at the University of Alberta's School of Public Health. And for the past 3 decades, he has provided local, regional, and national leadership on tobacco reduction in Canada on the whole gamut of tobacco control issues. And it's important to note that Les is based in a province in Canada that's maybe not the most automatically open to tobacco control. It's sort of like the equivalent of Texas in the United States in some respects. So he's been in a relatively challenging environment over those past 3 decades, but has contributed to much success. He has served as Canada's official NGO delegate at the last 2 COP summits for the Framework Convention on Tobacco Control. And he has received numerous awards for his work, including a Meritorious Service Medal from the Governor General of Canada, an Award of Merit from the Canadian Public Health Association, and others. So certainly has been sort of known for all of his contributions, the ones that we see, and of course, and the ones behind the scenes. He also has a number of publications and has given many presentations. And his work sort of in Canada has now clearly expanded with his vision and bringing to fruition of the Global Tobacco Control Progress Hub, which will be the focus of his presentation today. So this is a tremendous new resource that I'm really excited to hear about. So Les, welcome. And I will hand it over to you.
Well, thank you so much, Joanna. It's an absolute delight to be here with everyone today. And I would really like to express my deepest gratitude to Joanna and the Institute for Global Tobacco Control for all of their support and guidance, and including financial support with the development of this hub I'm going to be talking about today. It's been a wonderful experience. We've been at this for about 9 months. So it's been a 9 month gestation period leading up to the birth of the Progress Hub. But Joanna and her team have been wonderful. From early on, she shared our vision for improved monitoring and surveillance system for the Framework Convention. And we're delighted to share the details with you here today. Okay, so I want to start by just giving you some background on ASH Canada. Joanna already talked about what we do and have been doing since the organization was founded in 1979. I haven't been around that long, but we've been on the scene for a long time, one of Canada's longest serving tobacco control organizations. Over the years, of course, we've helped to shape regional, national, and even global efforts to prevent and reduce tobacco use. We've taken an active role on everything tobacco control, smoking bans, tobacco taxes, marketing restrictions, point of sale laws, etc. The menthol ban. Joanna mentioned Edmonton is in a very Western Canada, so the challenges here are a little harder than elsewhere. It's kind of cowboy country, Texas North, so we've had to put a little more work into our efforts to achieve success, but we have, and we've had to be a little adept at framing and bringing the public along with us when the governments weren't ready. Recently, within the last couple of years, we've taken on more of a knowledge to action agenda, which leads up to the Progress Hub, but we've been doing more work on knowledge to action and just converting evidence to action. And like a lot of people, we're spending way too much time on youth vaping right now. It's a huge opportunity cost for tobacco control. And hopefully we can resolve these issues sooner rather than later. I'd also like to give a plug for the School of Public Health at the University of Alberta, which is Canada's first accredited School of Public Health. We've got a lot of bench strength on healthy public policy, global health, chronic disease prevention, and community health. And this includes a number of international collaborations, including with folks at JHU. And I've had an adjunct appointment there since 2009, and I teach a graduate course on public health advocacy, which is a hands-on 13-week real-time, real-life advocacy campaign. And the students choose their own topics, and rarely do they take my suggestion, but they've done some really good work, and it's amazing what a bunch of graduate students can achieve in 13 weeks. So I'm here today to talk about the Global Progress Hub, which was just launched yesterday. We're super excited about this new platform, and it provides a new window on the world of FCTC treaty implementation. And it allows all tobacco control stakeholders to take an active role in treaty monitoring, surveillance, and reporting. It consolidates a number of major data sets and allows for comparative analysis, planning, strategic planning. It's intended to support and enhance treaty implementation. And so today I'm going to provide you with some context and background onto how all of this came about. And we do have reports that are provided by WHO on the framework that come out every 2 years, framework treaty implementation, and of course, MPOWER implementation. MPOWER is the high impact elements of the framework. And these reports are extremely valuable and have served as the basis of reporting for treaty progress over the years. But they are documents, and there's only really so much that that can be shared in a 200-page document, and hopefully the Global Progress Hub will expand on that. And in terms of the available data, there's been limited but some access to the WHO data sets through the Global Health Observatory, for example, through the biannual reports I just mentioned, through the FCTC country reports, which are posted online. So a lot of this data is actually available, and we've simply consolidated and digitized a lot of this information and made it available in a more digestible functional format. One of the problems leading up to the hub, or one of the, I guess, the needs, the justification for the hub, is low reporting rates, shadow reporting rates among civil society organizations. So we're also hoping to boost that through functions of this Progress Hub. I'll talk more about that in a few minutes. And also, we had when I was looking for good, solid, hard, raw data to compare Canada's progress with other countries a couple of years ago, and I really wasn't finding the hard numbers I was looking for. And I was referred to a paper done by Dr. Golem Hateri in Tehran, who had actually prepared a comparative analysis of Empower for one reporting period for every single country, including scores and rankings. And that was just a real eureka moment for me. I contacted Dr. Hateri, asked him if he was planning to update it for the current data set. And I think he was quite involved with COVID at the time. And I offered my help, and we have produced another paper, a new paper, that explores all the reporting periods for Empower. So we just published that, in fact. And here it is. And it's the first paper to report the full longitudinal results of Empower from 2008 forward. We explored the effect of several covariates on Empower implementation, including income, Human Development Index scores, literacy levels, government structures, corruption index scores within countries. And we also looked at several tobacco control indicators, including spending on tobacco control, national spending, national staffing, and then the existence of national objectives for tobacco control. So the paper provides a number of insights, and we did provide breakdowns of the results by WHO region, World Bank income levels, and by HDI index as well. So there's some good information in that paper. And that paper really was the genesis when we decided that this data, this information is just too valuable to remain in, to serve. And there's too much information just for one paper. So we needed to get the information out and make it more widely available. So why do we need a Progress Hub? Well, first and foremost, to fully liberate the existing data sets for the Framework Convention and Empower, and to make them available, readily available to everyone, easy, instant online access. To provide ranking and scoring for articles and Empower measures by reporting country, so that we can actually compare apples with apples, and even look at clusters and groupings, you know. So it's not fair, for example, to compare Canada with Cambodia. So, you know, we can compare by income rankings or by Human Development Index scores, etc. The hub allows for data breakdowns, comparisons, and groupings, and we'll get into all of that. We can reveal multi-year trends by country, and that's exactly what the hub does. Of course, engaging more tobacco control stakeholders in surveillance, monitoring, and reporting, which is Article 20 of the Framework Convention, and it's a cornerstone of the Framework Convention, in fact. And of course, to support improved treaty implementation, including such as shadow reporting, producing profiles on all the articles which are forthcoming. There's a lot of potential here, and we're just getting started. Okay, so you know, these are the reports commissioned every 2 years by alternating years by WHO. We're all familiar with these, and they're very valuable and contain top-line results of treaty implementation and Empower implementation for all the countries. But because they are 200-page documents, they don't provide every opportunity for comparison. And they can't contain the full data sets, because the full data sets represent several 100,000 data points. So we're trying to build on that with this particular platform. The purpose of the hub is simply to deploy a robust, interactive, user-friendly, and functional online visual analytics platform to actively monitor, measure, and shape tobacco control progress and performance among nations. So, you know, we're hoping to help. You know, we're definitely not overestimating our impact here, but we do want to support improved implementation and give people a better idea, countries, NGOs, tobacco control professionals, a better idea of what kind of progress is being made and where the gaps are and where the opportunities are. And, you know, of course, we want to shed more light on treaty and really what it's all about. And here is the text for Article 20. It's considered a cornerstone, as I mentioned. And, you know, Article 20 should not be the exclusive domain of academics and researchers with specific research questions and objectives in mind. Everyone should be engaged in treaty monitoring and surveillance and reporting, right? And that's why civil society organizations are encouraged to submit shadow reports. And that's why civil society is considered a fundamental element of the treaty and treaty implementation. Well, okay, so we had some very high expectations of ourselves and continue to in developing this hub. And you can see the bottom, the wow factor, that was a big part of this, is just to provide a platform that's engaging and that invites people to visit the hub and to look at their progress and see, look at the comparison data, look at the breakdowns, you know, provide an interesting, engaging, and uncomplicated user experience. Also, an experience that's practical, efficient, that we have functional features and capabilities in the hub that people can use in their tobacco control efforts. And we didn't want to reinvent anything here. We wanted to build on existing indices and reports, such as the Cigarette Tax Scorecard, Tobacco Industry Interference Index, the work of Campaign for Tobacco-Free Kids, and of course, the work of the WHO. And support treaty implementation, of course. There's the wow factor, okay. So to get the job done, we relied on a prestigious advisory committee of people with lots of experience with the treaty and treaty implementation, and with developing indices and scorecards and such of their own. So we're very delighted to have these people. A lot of them are Bloomberg Initiative partners. And they were very freely giving of their time and their advice and their expertise. And we asked everyone to be very candid. And we got lots of candid and constructive feedback along the way. And we are extremely grateful. And I had a small team in Edmonton helping me with the hub, including our research director, Fadi Hamal, who I rely on extensively for anything to do with research and design, survey design and development, qualitative research. And Alexa Thompson was our research intern who helped to actually assemble a lot of the moving parts for this hub. So we were happy to have them both. We also relied on several consultants and vendors, including our developer, Keyris Inc. And Keyris was wonderful. And they did a great job of turning a whiteboard concept into virtual reality. So now let's go over the potential features and functions. Now, these were the potential features and functions we had in mind when we were developing the Progress Hub. We didn't know if we would actually be able to do all of this stuff. But we were including displaying all the FCTC indicators. Now, those aren't quite all of them, but We did have to do some bundling and pruning, but we do have 248 measures, including ranking and scoring. We've been able to display all of the include all the Empower indicators, which are 42 plus the 7 Empower measures themselves. We are providing global and regional comparisons as stated, comparisons by articles and indicators, and comparison by Empower measures and indicators. We are also, the hub also provides comparisons by income gradient and HDI gradient, country profiles of tobacco use behavior, and we'll be producing more of those as we move along here. A creation of downloadable tables, charts, graphs, etc. So, we're giving people all kinds of resource materials for presentations, papers, etc. Just want to freely share all of this information online. Downloadable natural shadow reports, and the hub itself. It contains over 300 indicators covering over 180 countries, spanning 12 years reporting, and over 400,000 data points. And that's version 1. So, and here's all the content we have compressed into the Progress Hub. We've got all the FCTC data sets for all reporting countries for 3 reporting years. There's data going back further, but the data collection system changed in 2016. So we've just used the data from 2016 forward. And then we've got all the Empower data sets since 2008. In HDI gradients, income gradients. We've got adult and youth national smoking data that was supplied by the WHO Secretariat, who's the FCT Secretariat. And the cigarette tax scorecards by Tobacconomics, the Tobacco Industry Interference Index by the Center for Good Governance and Tobacco Control, and various tobacco control policy sheets produced by Campaign for Tobacco-Free Kids. Here are all of them assembled. The external profiles we've included on the hub, assembled by article. And in fact, when you're visiting the hub, you will find them aligned with each article. And this includes the Empower country profiles as well for a number of articles. So it's a lot of content. And we continue to build, right? And we're eager to keep adding. It's really limitless, but we do want to keep this very user-friendly and practical as well. So, like any data set or database, there are a number of limitations involved. And the FCTC and Empower data relies on self-reporting by national focal points. I think we all know that. We were only able to include the binary indicators from the FCTC data set. A number of the questions are open-ended. And it's hard to include paragraph-long answers in an online platform like this. So, but most of the answers are yes, no, or most of the questions are yes, no. So we were able to include most of the responses. We had to do some bundling and pruning as well. And we found that under a few articles, like Article 8, which is smoking restrictions, and Article 14, which is tobacco dependence, that there were I would say almost an overrepresentation of indicators. If you're looking at smoking bans, I think we bundled under workplace, and then the workplace was broken down into several different categories. So, we just had to trim, and that was all done with the advice and guidance of the advisory committee. These weren't arbitrary decisions. The data set, there's a number of unreporting countries. And for instance, we have 181 countries who are members of or who are parties to the Framework Convention. But that's not all countries. We have 195 countries who are members of WHO who report Empower data, but that's not every country. We have over 200 countries in total. There are variabilities in country smoking behavior data. So we've had to, and that's reported on the Progress Hub. In fact, when you're looking at the data, you can even see the source of the data. And because the data is not reported by every country, that does affect rankings, right? When we're ranking countries, we're excluding those that are not participating in the treaty or that haven't submitted Empower reports. So that has to be qualified. And then there are limitations of the WHO data sets themselves. And here's some. And this is just a comparison of the FCTC and Empower data sets and the pros and cons of each. And they both inform the implementation of the treaty. They're both extremely valuable. The Empower data doesn't include demand side or supply side measures. It doesn't address tobacco industry interference. Again, pros and cons to each, taken together, they're both extremely valuable. So we have some plans. This is the foundation. This is version 1 of the Progress Hub, and we've got plans, and we're looking for more ideas, so feel free to contribute. We will be producing implementation profiles for each FCTC article and Empower measure, and we're planning to do all of this prior to COP10 next fall. We're going to be preparing also implementation profiles by region, income level, and HDI score. We're going to be adding 2022 data sets as they become available for FCTC and Empower. We're going to produce 2 new dashboards, one for MOP, which is the International Protocol on Contraband Tobacco, and we're going to have a special dashboard for data queries. And I'm sure the researchers will love it. And we're going to be doing a user survey in the spring of 2023, so we can quickly gauge feedback and get your suggestions and ideas and make any corrections that are necessary. And just in general, we're going to be adding more dashboards, features, functions, and capabilities. Now, there's a bunch of people to acknowledge here, and I hope I don't miss anyone. Starting with the Institute for Tobacco Control and Dr. Joanna Cohen for sharing our vision for the Progress Hub, for understanding that we were building something from scratch. And it would take considerable work, and for helping us make all the connections we needed to make, even assembling the advisory committee. I really can't thank the Institute enough for everything on this. We're extremely grateful. Bloomberg Philanthropies, which is supporting the Progress Hub through a grant that is through a sustaining grant for Johns Hopkins, the Institute for Tobacco Control. Want to thank very much the Secretariat for the WHO Framework Convention, who sat on the committee and participated and provided us with lots of good, constructive, candid feedback. Same with the folks from the WHO Tobacco Free Initiative, who are on our advisory committee. And the whole committee. I shared the photo, but we can't thank all of these people enough. Dr. Hadery, who wrote the initial paper about Empower implementation that sparked our interest in building on that analysis, including all countries, and then expanding it to include the Framework Convention data as well, and building an online analytical hub platform for all of the data. Kiris, who is the developer, and they made a lot of changes along the way. There was lots of back and forth, and they were very accommodating, and are well versed in Tableau, which is the platform we're using. And of course, I want to thank the ASH board, staff, consultants, and the vendors. So this is what I like to do when I'm not fighting tobacco companies. And this is my daughter. She's in her second year of nursing at the University of British Columbia. So she's taking the Ruth Malone route into tobacco control. But actually, I've told her, not told her, I've suggested, because that's all you can do. I've suggested that she can do anything she wants in life except fight tobacco companies for a living. So I'm hoping that she stays clear of the tobacco lobby. Here's my contact information. Please feel free to reach out at any time if you have any questions, comments, suggestions, or ideas. I'd like to thank all of you for participating. We're now going to show a 12-minute video, instructional video on the hub and how it functions. And we invite you to put your questions and answers in the question and answer text box. And we'll be back in about 12 minutes to answer your questions. Thank you so much.
Welcome to the Global Tobacco Control Progress Hub. This interactive data visualization platform was created to support enhanced monitoring, surveillance, and reporting of the WHO Framework Convention on Tobacco Control. The Progress Hub includes over 300 existing tobacco control progress indicators that measure the implementation of the treaty and its impact on the global tobacco epidemic. Over 180 countries are reporting their treaty progress to the World Health Organization, and this information has been consolidated on the Progress Hub. This video will guide you through the basic features and functions of the Progress Hub. For best results, we recommend using a desktop or laptop computer with a stable, high-speed internet connection. The Progress Hub is compatible with several internet browsers, including Chrome, Firefox, Safari, and Microsoft Edge. Please ensure you are using the latest version of the required browser. Please note that this platform is not intended for use on mobile devices, including smartphones and tablets, due to viewing, processing, and speed limitations. Now, let's begin. You can interact with the datasets in the Progress Hub through 4 user dashboards. You can select each dashboard from the list at the top right of your screen within the header bar. We are going to start by viewing the main dashboard, which is also the default selection. On the main dashboard header bar, you can start by selecting the dataset you would like to explore by clicking on the FCTC or Empower logos. In addition to viewing overall global results, you can also select any reporting country and the reporting year from these drop-down lists on the header bar. You can also go back to switch between the datasets you are viewing for the country and year selected by clicking on the FCTC and Empower logos. The map chart below the header bar provides you with a biennial visual representation of treaty implementation for the chosen dataset. This revealing map chart allows you to quickly compare the degree of treaty implementation between countries. You can hover over any reporting country to obtain its implementation score for the FCTC and Empower indicators based on information reported to the WHO. Using your mouse, you can access the navigation bar to zoom in or pan over the map. You may need to use the navigation bar to find small countries that are not readily visible on the default view. On the left side of the screen, you will find the latest reported adult and youth smoking behavior and the tobacco mortality rate for the chosen country. The two charts at the bottom left of the screen represent the MPower and FCTC implementation trends for each reporting country. You may find it useful to share the reports and data visualizations you generate. At the bottom left of each dashboard, you can choose from a variety of file types to save or share your output, including PDF, PowerPoint, or PNG files. Let's also turn our attention to the blue icons at the bottom of each dashboard. You can learn more about the Progress Hub by selecting the question mark on the left, or select the exclamation mark in the middle for information on data limitations. User feedback is also valuable, so you are welcome to select the contact icon if you have any questions or suggestions regarding this data platform. Selecting the user guide icon will provide you with an instructive one-page description of each dashboard. In this chapter, we will explore the WHO FCTC dashboard. This view includes over 250 indicators represented in a color-coded sunburst chart. The sunburst chart provides an immediate perspective on treaty implementation for each reporting country. Each color represents one of 15 treaty articles. You will find the overall FCTC score and ranking for the country you are viewing in the middle of the sunburst chart. To the right of the sunburst, you will find the articles listed in a color-coded legend. You can select each article for details about its degree of implementation. You can also select the reporting year at the top right side of the sunburst. Each time you select a different article, you will notice that the progress charts on the right side of your screen will change to reflect the relative score and ranking that corresponds with the selected article. Looking within the header bar, you will find three drop-down menus. The first two will allow you to select the country and article you wish to view. The grouping drop-down then allows you to select clusters of countries based on region, income level, or Human Development Index. This feature allows you to compare your selected country with its peers within a geographic area or within a relative income or human development gradient. The comparison results are provided in the map chart and bar graph below. You can use the navigation bar to zoom in or pan over the map. You may need to use the navigation bar to find small countries that are not readily visible on the default view. If your view becomes frozen or unresponsive, please use the refresh button. To the left of the map chart, you can view the scoring trend for the selected article in the chosen country over all reporting periods. You can learn more about each FCTC article, including implementation guidelines, third-party profiles, and the actual FCTC reports submitted by each country to the WHO by downloading any of the informative PDF documents found just below the sunburst chart. At the bottom left of each dashboard, you can choose from a variety of file types to save or share your output, including PDF, PowerPoint, or PNG files. In this chapter, we will explore the MPower dashboard. This view includes 50 indicators represented in a color-coded sunburst chart that provides an immediate perspective on MPower implementation for each reporting country. Each color represents one of 7 MPower measures. You will find the overall MPower scores and ranking for the country you are viewing in the middle of the sunburst chart. To the right of the sunburst, you will find the MPower measures listed in the color-coded legend. You can select each measure for more details about its degree of implementation. You can also select the reporting year at the top right-hand side of the sunburst. Each time you select a different measure or indicator, you will notice that the progress charts on the right will change to reflect the relative scores and ranking that corresponds with the selected measure. Looking within the header bar, you will find 3 drop-down menus. The first 2 will allow you to select the country and indicator you wish to view. The grouping drop-down then allows you to select clusters of countries based on region, income level, or Human Development Index. This feature allows you to compare your selected country with its peers within a geographic area or within a relative income or human development gradient. The comparison results are provided in the map chart and bar graph below. You can use the navigation bar to zoom in or pan over the map. You may need to use the navigation bar to find small countries that are not readily visible on the default view. If your view becomes frozen or unresponsive, please use the refresh button. To the left of the map chart, you can view the scoring trend for the selected Empower measure in the chosen country over all reporting periods. To learn more about each Empower measure, including third-party profiles and the WHO Empower profile for each country, you can download any of the informative PDF documents found just below the sunburst chart. At the bottom left of each dashboard, you can choose from a variety of file types to save or share your output, including PDF, PowerPoint, or PNG files. In this chapter, we will explore the Country Comparison dashboard. As the name implies, this dashboard allows you to select, view, and compare the FCTC and Empower's scores and rankings for up to 4 countries at a time. Within the header bar, you can choose the criteria you wish to view by selecting from the drop-down menus labeled FCTC Article, Empower Indicator, and Reporting Year. You can select any 4 countries at the top of the columns appearing on the dashboard and compare the results of selected countries. You can also compare the results for similar FCTC articles and Empower measures. You may find significant differences between similar measures in the 2 datasets. These differences may reflect variations in survey design, data collection methods, and reporting. For example, the FCTC data represents unvalidated reporting by government officials in each country. The Empower data is validated by WHO regional officials in consultation with non-government tobacco control stakeholders in each country. However, both datasets have advantages and disadvantages, and they both inform the implementation of the treaty. You can find a summary of the differences between Empower and FCTC datasets by selecting the About icon at the bottom of the dashboard. The Limitations icon will also help you to interpret each dataset. At the bottom of each dashboard, you can choose from a variety of file types to save or share your output, including PDF, PowerPoint, or PNG. This concludes our review of the 4 Progress Hub dashboards. We hope you enjoy your experience with the Global Tobacco Control Progress Hub.
Wonderful. Thank you so much. Thank you, Les, for sharing sort of all the background leading to the Progress Hub, and and telling us and showing us what it includes and all the things you can do with it already. So I'm going to jump into questions because we just have a few minutes, and for folks joining, please don't hesitate to put any questions into the Q&A box. So the first question is whether the hub includes tobacco-related disease burdens by country.
The hub includes a tobacco mortality rate, for each country, at least for the reporting countries, and you'll see that rate on the main dashboard, just above the, to the upper, on the upper left-hand part of the dashboard. We are absolutely willing to look at including other data sets in the future. I know the IMHE has extensive data. We have the Global Chronic Disease Survey data. So there are some big data sets out there. We're building a foundation here, and we wanted to be quite selective at this point, so as not to, we don't want to overwhelm users either. But because it's digital, we can make these changes and improve upon the hub as we go forward.
Great. And the next question, how is the data sharing policy to do further research or publication using the data from the hub?
We haven't discussed that yet, Joanna, but I think it would be polite for people to acknowledge data that they have obtained from the hub. Please keep in mind that the data source, because we are simply displaying and reflecting on existing data sources. So, the FCTC data is the data source is WHO, for example. So, but we would appreciate acknowledgement. It's been a lot of work, and hopefully we will get some acknowledgement in publications going forward.
Great, thanks. And I wanted to ask you about the shadow reporting features of the hub, because I know this was a big part of your motivation for the hub and your vision of what it could do. And we saw, in the videos too, how you can download certain graphs. But you just talk to us about why this was so important, and just remind people what they can do in terms of shadow reporting and advocacy within their countries.
Absolutely, Joanna. Well, part of the motivation for the hub is that the observation that national shadow reporting rates are low, and yet civil society is considered to be a fundamental element of the Framework Convention and its implementation. So I think anything we can do to enhance and promote shadow reporting is going to be helpful to overall implementation. So this is a function, it's a behind the scenes function that's built into the hub. It will be available exclusively to NGO members of the Global Alliance for Tobacco Control, and people will be hearing more about that in the weeks ahead.
Great. We have another terrific question. Can tobacco and vaping companies access the hub and use this information to target countries?
Well, I think it would be very, I think people should know that they were probably using data analytics before we were. And data analytics is not a new field by any stretch of the imagination. All of the data sets we've put online are already public. They're already available to the tobacco industry. Data analytics are used by many, many industries. And in many respects, it's only about time that the tobacco control community is catching up, especially when we've got all this data. But hopefully the hub will be put to more good use than bad, but it won't. In my opinion, the data that's available could have already been accessed by the industry and probably already has.
Yeah. So the hub is available right now. It is not password protected. So you can access it, well, you saw on the slides, but www.globaltobaccocontrol.org/Progress Hub. So you can access it there, and we'll have the video that you saw, it will be shortly available on our YouTube channel, along with some translated versions as well for your colleagues who would prefer the tutorial in some other languages. So I think those are the questions. Les, any other remarks you'd like to make?
Well, I would just like to invite people beyond this webinar to provide us with their feedback. And there's a contact icon at the bottom of all the dashboards, and we want to hear from people. We want to build on what we've created here, and we're looking for good ideas and suggestions. If you know of data sources that you think we should be including, please let us know. And we'll be sending out a user feedback survey in the months ahead as well. But this is a version 1, and we're really looking forward to developing the hub further and to getting various resources out there that can be produced from the hub to support and enhance treaty implementation, particularly among civil society organizations.
Wonderful. Well, thank you so much. Thank you for your vision for producing this hub and for doing it in record time. As you said, this was like 8-9 months, which is incredible. And we've got such a useful resource publicly available for folks to use and explore. And, you know, the goal is to improve the implementation of the Framework Convention in tobacco control in each of our countries. So I think this will help with those objectives. So thank you so much, and enjoy the hub. And thank you, Les.